So going after his pelvis, going after quad, tender. Opening up the quad, going into his patellar insert at the tibia. Again, going back through quad fibers, looking at those knots in there. Pausing a second to give it time to unlock. Good. So, anterior tibialis, calf muscles, popliteus right there. I'm hitting everything as I go. So I'm going through, I'm palpating and feeling where there's a challenge, where there's tenderness, and I'm also fixing at the same time I'm palpating because I'm using specific pressure at the osteotendinous junction to alter the autogenic inhibition reflex. I like to create a lot of traction in joints versus jamming them, so I open up the ankle joint, wiggle it around. I'm going to open up the hip joint. I'm going to try and unlock and give it a little tug to open that and free that up, and I felt the hip joint totally open up and release. Fixing bodies does not need to be traumatic. I'm going to go after his psoas and iliacus by creating rotational torque, just like we did with the pec. We're doing this with the psoas muscles. And doing the same thing on the other leg. Coming in, stabilizing at the AIIS as I go through the quad muscle, compressing straight down perpendicular into the fibers as I'm working down towards the kneecap. Once I get to the kneecap, I'm going to traction the muscle a little bit. At the osteotendinous junction at the tibia, I'm going to push those quad fibers right into that tibial plateau. On teenage athletes, that's usually very tender, and that's a huge way to fix their knees. Again, going through the quad fibers, opening up adhesions that are in there, and then going in anterior tibialis, medial calf, popliteus muscle, opening up the ankle joint, opening up the hip joint, nice and easy. Go in, address hip flexors. I can come into the adductors and go right through. I can either squeeze the muscle fibers, and I can go in to the insertion points and press them into the bone, which would be towards the knee. Good. Squeeze your knees together. Hold, hold. Excellent, good. Going into the iliacus, what I'm going to do is I want to go take his pelvis and go inside the pelvic rim as best as I can. So I'm taking my fingers and kind of hooking down inside where it's really sensitive along the inner border of the ilium. Sensitive, yeah?
A little bit. Right there. Not
Yeah.
too bad there.
And then how's the other one?
It's actually better on that side.
Yeah. So the other thing I can do is, here's the ilium bones. When the iliacus muscle is tight, that the ilium closes down like a clam. I'm going to open it up. So I'm going to take both of his ilium and I'm going to press down and then open, spreading it open apart. And that should feel really great. Mothers that have had multiple children, this is an awesome thing to do for them. Going into his oblique muscles, they're attaching at the rib cage. His core muscles attaching at the rib cage. I'm pushing up into those, looking for any areas where there's sensitivity, where there are adhesions or dysfunction. I'm going to squeeze into the muscle fibers of the obliques. Again, wherever I find adhesions, I'm going to hold for a minute, and I can check both sides. While I'm holding one, I can work the other. Pec muscles, I can just move right up, rotate the arms open. For his anterior scalenes and platysma and SCM muscles, I can traction all those out right through here. I can get into the collarbone behind it where the upper trap fibers come. Now I'm going right into the trap fibers using my thumb straight down in. I can squeeze them a little bit. And then I can go into the spine of scapula and go in there, and then I can start working on the traps where they go into the spinous processes in the neck, up into the base of the skull, splenius and scalenes on the transverse processes, Going into the SCM muscles. As you see, I'm just cruising along, fixing what I find. As I find it, I'm already fixing it. So the palpation becomes the correction. Going into his anterior transverse process of C1 and looking for the one that's really nasty, like that one.
Actually, the other side felt a little bit worse.
That one did too? Okay, we get both. From here, we can go right in and traction some of the trapezius muscle out. I can go right into my occipital nodding. And then I can go right into occipital traction. Click, that opened, that was nice. And now you can go face down. From here, we're going to start at the hamstrings, going right into the belly of the muscle, getting those fibers released. I'm going to go down through his calf muscles. Again, anything that comes up, I'm going to go after. So I was going straight in, and now I'm going perpendicular in a lateral to medial format. And again, he's got a little stuff going on in there. And then I can go do the same into the hamstring. Again, just using the heel of my hand to go down in through the belly of the hamstring muscles and doing that down into the calf muscles. Feeling where the fibers are, where the tension is, trying to get that to release and unlock. And so then I can squeeze through the fibers, looking for where he's got tension. And we can work through that. Hamstrings come up and insert into his ischium. From there, I'm going to come in and just push right up into his ischium and help set that hamstring right back into that bone in a cleaner way. I can come up and go through on the underside of the sacrum is the piriformis, so I'm going to go right up underneath there. I can come out to the femur and I can look at the posterior aspect and see where those piriformis fibers come in and see if there's any tenderness. I can actually do both at the same time. When I'm working on the femur head, or the top of the femur, I'm looking at the heel to make sure that when I press, I'm seeing external rotation occur in the heel. That way I know I'm torquing correctly through that femur. Glute fibers, I'm going to go along the sacrum, right up to the SI joint, and then start going across the pelvis towards the glute minor fibers, or glute medius, and then glute minor. And then I can go from the glute minor fibers down into from the pelvis down into the top of the femur. And so those fibers going from pelvis to femur, we want to make sure they're all happy, pushing right down into where they're tender on the top of that femur. That's pretty tender there, yeah?
I've had some SI joint stuff going on that side.
More on this side? Okay. Piriformis muscle test. Taking that, dropping the back of the knee, keep that there, hold, be strong. Yeah, and then I'm going right up under, scooping under, if I can, his sacrum, just using my thumb to kind of get right up under into where that's a little sensitive, yeah? More there? Or is that more just lateral?
Definitely sensitive, but more sensitive on the greater trochanter.
Okay, hold that there. Good, and now we're 5. Yay. On his quadratus lumborum, coming up under the rib cage, I'm going to take and go in and up. So I'm pressing inferior to superior with a little lateral to medial. And I'm going to go along the transverse processes, digging under the paraspinal muscles to get to his transverse processes in his lumbars and comparing left and right, L1 to L5 QL. I can continue working on the obliques, pushing up on the ribs, pushing down on the pelvis, squeezing the fibers in the middle. While I'm here, I can go to his lats, squeeze into the belly of the muscle here, looking for where that's all an issue. At the spinous process, I can take and push into and work my way down. Spinous process is looking for the one that's really, really nasty. And again, this goes all the way down to sacrum and a little bit across his pelvis. So starting about T8 and then just going down. And I can always ask the patient for feedback. And then when we fix it, we go back and retest. Also, for the lats coming down to the tailbone, if both of them are an issue, this tailbone is going to be up. So I want to push it down. And that should feel really, really good. Yes? And then those lat fibers come attached to the lateral aspect of the ilium, so I can do both ilium down. From here, I can go right into trap fibers coming into the spinous process. I can go right into the spinous processes looking for what he's got going on here, if anything's jumping out. A little tenderness there, yep. Yeah, right there at about T3, T4. A little tender, yeah? Good. So under occiput, I can lift up through there, open that up. I can squeeze into the spinous processes, looking for any dysfunction going on there and fixing while I'm palpating. And then going to transverse processes, and I'm going up the transverse processes. We're going to do this pec minor correction since this was a shoulder we were working on earlier. So again, I'm going to come in and squeeze that right there. That feels really good, yeah? Good. And let's do the other one. Awesome. Thank you.